All right, antibiotic resistance. This is important. It is happening in the United States today. It's happening worldwide. And so we kind of need to think about antibiotic resistance and how it affects us, our animals, and our clients, okay? So basically, antibiotics are natural antimicrobials that are secreted by one microorganism to inhibit another. And the microbe that secretes the antibiotics also carries the gene for resistance. So basically, penicillin has the gene that codes for resistance. So that's how we eventually develop resistance with our antibiotics. So bacteria change in some way that reduces effectiveness of the antimicrobial agents. So this is basically a short way of what antibiotic resistance is. And it does that a few ways. It could mutate, so basically they evolve quickly. One cell could mutate and not be affected by the antibiotic, and then all the other cells may die off, a few of the other cells may die off, but that cell, that bacteria that was not killed by the antibiotic will continue to multiply, thus making all of its offspring resistant to the antibiotic. There could be genetic transfer, and so basically you kind of take that mutated one and the genes of that mutated one can actually transfer, or an unrelated bacteria's genes that is not susceptible to that antibiotic could transfer, thus getting antibiotic resistance. And then there's something else called cross-resistance, and basically this is resistance within similar structured antibiotics. So penicillin, bacteria that's resistant to penicillin tend to be resistant to cephalosporins also because they have a very similar chemical makeup. So why does this matter to us? Well, this matters to us because I think there's something like 90% of cases that have been seen in humans in the United States, 90% of those bacteria are now resistant to amoxicillin and to penicillins. The reason why they're resistant to these drugs is because they've been overused. They've been overused by humans, human doctors. They've been overused by food producers, okay? And some say that they've been abused by veterinarians because veterinarians just willy-nilly give out antibiotics. I don't know how true that necessarily is nowadays. So some things you need to think about with antibiotic resistance. So in order to prevent the resistance, we need to do proper hand washing. This is simple. Just make sure you wash your hands properly with soap and warm water. And really, it's the action of moving your hands that gets rid of the bacteria more than the soap, okay? It should be confirmed whether that patient has a bacterial infection or not. We're going to talk about urinary issues later in the class, but one of the ones that comes to mind for me is that cats, I think it's something like 50% of cats have a feline lower urinary tract disease. Those cats actually have something called feline interstitial cystitis, or FIC. They do not have a urinary tract infection. Okay, but a lot of times what happens is the owner brings the cat in, the cat's been urinating around the house, the doctor is at a loss of what to do, so the doctor gives them some antibiotic. Well, FIC tends to resolve itself in about 14 days. One normal course of an antibiotic tends to run 10 to 14 days. So what happens? The client sees the cat is better, and now that antibiotic cured the cat. Well, really, that antibiotic had nothing to do with the cat, or an infection, because the cat didn't have an infection. It was just something that the client saw. It was just something that was happenstance, okay? So we need to think about that. That's why we need to make sure that it is a bacterial infection before we actually hand out antibiotics. Ideally, we should do culture and sensitivity to make sure that we are using the correct antibiotic for the correct bacteria. We should also identify it. Is it gram-positive or gram-negative? Okay, is it Staphylococcus? Is it Streptococcus? We kind of need to know which it is. Is it Pseudomonas? totally different drug that we need to use for that, okay? We need to make sure we tell the clients to use all the medication, okay? You yourself, if you are prescribed antibiotics, need to make sure you use all the medication, and your clients need to make sure that they use all of the medication as directed, okay, by the veterinarian. So I said use as prescribed, following the rights, okay, the R's. So that's the right patient. They shouldn't be giving this antibiotic to another one of their animals. They should be giving the drug at the right time. If the doctor says it needs to be given every 6 hours, they need to be giving it every 6 hours, not 2 tablets once a day, okay? Or 2 tablets twice a day. If they need to use the right route, if it's supposed to go oral, they need to make sure it's given orally. If it's not supposed to be given with food, they need to make sure they're not giving it with food. The one that's off of them, you know, the right dose, give all the pills that the doctor tells them, not half the pills. The one that really probably wouldn't matter is the right documentation. Okay, so we need to make sure that we're having our clients follow as many of the rights as possible. And we also want to, in our clinic, do effective sanitization. Okay, so we want to make sure that if an animal comes in with a bacteria infection, we need to clean where that animal was at. Because there is a, MRSA, which is methicillin resistant to Staph aureus. This has been cultured from dogs, okay? And MSR is actually something we worry about humans more than we worry about dogs. So it is something we need to think about, okay? Resistance is everyone's concern, and it's up to us to make sure we take care of that. But another portion of resistance isn't just proper hand washing, properly using the drugs. Another portion of resistance is residue. So we have drug residue, and basically drug residue is the presence of chemical or metabolites in animal tissue or food products. At the beginning of class, the beginning week, we talked about food residue. We talked about FARAD, okay? But I'm going to go over it again because this is what is really important, okay? Residue in food products, especially especially antibiotics, people can have severe allergic reactions to antibiotics. I am like a large percentage of the population. I am allergic to penicillin. If there was penicillin in my food, I potentially could have a hypersensitivity to that food and develop some sort of reaction. Okay. The other thing with using, when we don't follow withdrawal times properly, and when we have antibacterial residue in our food products, is they produce bacterial resistance. Those bacteria that actually survived then can go on to multiply, which then can cause more problems. And this is why we need to make sure that if we're working with large animal, that we're following FARAD, the Food Animal Residue Avoidance Database. The FDA has given us guidelines for withdrawal times. They have also identified antibiotics that cannot be used extra label in food animals. There are some antibiotics that, if used in food animal and get into our food chain, could actually cause aplastic anemia in humans, which means you can't come back from that. So it's very important that we're not using it. And something important to remember about residue is cooking or pasteurization does not remove residues. It can be found in meat, it can be found in egg products, it can be found in milk. So we need to think about these things when we're talking about antibiotic resistance as well as food residues.